So my portfolio presentation is on endometriosis and opioids. Basically, the article just examined whether or not opioids was a good pain treatment for patients with EM, or if it was not as a smart choice to go just because opioids have severe side effects. So, introduction. Endometriosis refers to the condition in which cells similar to the lining of the uterus or endometrium form outside of the uterus. EM is defined as the presence of tissue while being surrounded by smooth muscle cells outside the uterus. This disease also involves pelvic tissue and can envelop the ovaries and fallopian tubes. Not to mention, if someone has EM, their other organs may be affected, such as the bladder or bowel. EM is reported to affect 10 to 15% of women of reproductive age, and also 70% of these individuals suffer from chronic pelvic pain and infertility. The etiology, unfortunately, is not definitive. However, there are possible hypotheses regarding the development of endometriosis lesions, and I will talk about that in the next slide. So the first possible mechanism is retrograde menstruation. This is the outflow of endometrial lining through the fallopian tubes leading into the pelvic space. This is a possible mechanism because the retrograde flow may result in the plantation of endometrial tissue in ectopic sites. Another possibility is that endometriosis lesions arise from Müllerian ruminants. These are basically just the ruminants that develop during fetal development and that they don't properly migrate. In addition, factors such as hormonal, inflammatory, or immunological environment may determine whether lesions implanted in the pelvic cavity persist. Also, if someone in your family has had EM, you're more susceptible to developing lesions as well. So, symptoms. Patients with EM have symptoms such as intermenstrual bleeding, painful periods, painful intercourse, painful defecation, and difficulty urinating. Oftentimes, EM can be asymptomatic, but if a woman goes to the gynecologist and is evaluated for infertility, EM will oftentimes be detected. Unfortunately, because the etiology and the exact pathogenic mechanisms of EM are uncertain, there is currently no curative therapy available for patients. Patients with EM have severe pain, and an important factor of managing EM is minimizing this pain. So, treatment. Pain resulting from EM is treated using NSAI drugs, Metamucil, and in extreme cases, opioids. New evidence has shown a promising functional profile of bifunctional NOP and MOP partial agonists as non-addictive and safe. Recent studies show that multi-mechanistic opioids are a better alternative to traditional opioids in order to minimize side effects and to prevent addiction. So basically, the whole article was about how the new multi-mechanistic opioids are better to treating EM than traditional opioids, and they're better than the typical drugs that patients are prescribed. Prior to recent studies, the role of NOP receptors in EM has not been thoroughly investigated. Investigating the role of NOP receptors may provide options to patients to relieve their EM-associated symptoms. The treatment goal for those who have EM is to alleviate pain because there's no curative therapy, and to prevent endometriotic lesions while preserving fertility. So recent studies show using opioids to treat EM pain is successful and the better alternative. EM has been treated primarily with NSAIDs drugs as well as Metamucil and opioids, but only in extreme cases. However, the response to these drugs is often ineffective and puts the patient at a higher risk of experiencing GI bleeding and also some other severe symptoms. Patients given Metamucil oftentimes develop agranulocytis and hepatotoxicity. Agranulocytosis refers to a condition in which one has an extremely low number of granulocytes. This is a specific type of white blood cell. As mentioned in a lecture, hepatotoxicity is the impairment of the liver or injury to the liver because of exposure to xenobiotics. whose studies provide evidence that opioids should be prescribed in order to treat EM-associated pain, although the prescription should be strongly supervised because of the risk of addiction. Recent studies have shown that there may be a possibility to use NOP receptors in terms of analgesia and improved tolerability as a target for EM-associated pain treatment. So in conclusion, the opioid system plays a crucial role in modulating neurogenic inflammation and preventing pain. EM is a chronic inflammatory disease with severe pain mediation and analgesia. Opioid system disruption could be involved in the inflammatory condition and pain pathogenesis. The opioid receptors, NOR and KOR, play an important role in visceral and inflammatory pain. According to the article, these opioid receptors are best fit to treat those with EM instead of current medications such as NSAIDs. In conclusion, recent studies prove that EM may be candidates for opioid prescriptions if said prescriptions are highly monitored. In addition, recent studies prove that outdated medications and Metamucil are not adequate for treating EM patients' disturbing pain and symptoms. So it's a story, and it's new because the new research is that this is relevant to health in humans because many people have EM, and it's alarming that we still don't have a curative therapy treatment, and we also don't even know the etiology of EM. So moving forward, we need to do more research to try and find the etiology and a curative therapy treatment for patients with EM. I also chose this because my mom has EM, and I've watched her have EM and have severe symptoms and then eventually get surgery and get her uterus removed. But it's just alarming that there's not really a lot of treatment, and there's not, like, she didn't really have that much help having EM. I feel like she didn't really have that many options as far as treatment goes. So I just wanted to do my presentation and project on EM because I wanted to do more research about it and learn more about possible treatments and if there were any new treatments going forward.